Hello everyone, let me introduce myself. My name is Christina, NPM H1A021021 from Medical Education Study Program, Faculty of Medicine and Health Education, University of Bengkulu. In this presentation, I will present to you a medical article entitled Maternal and Fetal Outcome of Pregnancy in Women with Connective Tissue Disease, written by Katarzyna Klimazik, Eva Wender, Ozegowska, Malgorzata Kezia, published in 28 September 2021. Contents that I will present are backgrounds, aim, material and methods, results, and lastly, conclusion. Backgrounds. The majority of patients diagnosed with systemic connective tissue disease are women of childbearing age. Systemic connective tissue disease are a group of autoimmune diseases that occur significantly more frequently in women than in men. In pregnant women, disease activity, extraarticular symptoms, and the patient antibody status play important roles in this pregnancy risk stratification. In the past, women with mixed connective tissue disease have been advised not to become pregnant because of the risk of disease recurrence and the lack of evidence for safe treatments during pregnancies. But now, with increasing science and technology, treatment has been provided. The aim of these studies was to analyze the obstetric results and exacerbation rates in these pregnancies of patients suffering from systemic connective tissue disease. Materials and methods. Material is the pregnancy outcomes of 14 women with systemic connective tissue disease. And the methods are all participants were followed up at the regular intervals with clinical and laboratory assessment during the entire term of the pregnancies. And also, in patients with anti-SSA or anti-SSB antibodies, the ultrasound assessment was performed. The period of this research is between September 2019 until July 2021. And diagnosis for patients are 3 patients diagnosed with systemic lupus erythematosus and 3 patients with rheumatoid arthritis, 3 patients with mixed connective tissue disease, 2 patients with overlap syndrome of rheumatoid arthritis and systemic lupus erythematosus, 1 patient with primary Sjogren's syndrome, 1 patient with systemic scleroderma, 1 patient with dermatomyositis. The following pregnancy outcomes were analyzed: premature birth, stillbirth, number of women with preeclampsia, gestational week of delivery, cesarean section rate, birth weight, Apgar scores in the first and the 3rd minute, number of infants with VGR, fetal growth restriction, and number of infants hospitalized in the neonatal intensive care unit or NICU. The data analyzed in the research were collected from the paper and electronic medical records of the patients. The results: 10 pregnancies occurred during the period of disease remission, and 4 of these pregnancies started while the patient was on corticosteroid medication. 1 patient with the systemic lupus erythematosus remission 9 months before conception and decided not to undergo the recommended mitral valve surgery before pregnancies. 5 of these pregnancies were unplanned. In these 3 cases, drug contraindication in pregnancies were administered in the first 3 semesters, including methotrexate in 2 cases and mycophenolate mofetil in 1 case. And we found 3 events that caused all of the result. The first one is effect of systemic connective tissue disease on pregnancies. Median duration of pregnancies was 37 weeks. One pregnancy ended at 28 weeks of the gestation by stillbirth, while preterm births occur in 5 of the 13 live births. At the 37 weeks, 2 of these pregnancies were associated with premature rupture of the membranes, while one twin pregnancy at 32 weeks was associated with infeasible labor. Second effect of systemic connective tissue disease on neonatal outcome. The mean live birth weight of the neonate was 2787 grams, and the median Epgar scores at 1 and 3 minutes was 10. There was one stillbirth at 28 weeks gestation at patient with mixed connective tissue disease. This pregnancy was unplanned, started while the patient was taking methotrexate, and an exacerbation of this disease occurred at 15 weeks of the gestation. The neonate's birth weight was 760 grams, below the first percentile for gestational age. For other disorders, there were 4 cases of VGR, fetal growth restriction, and no cases of neonatal lupus. And 4 infants were hospitalized in the neonatal intensive care unit. The third effect is effects of pregnancies on systemic connective tissue disease. In total, all 4 patients with active disease at conception and 1 patient who did not undergo recommendation mitral valve surgery before pregnancies development symptoms suggestive of an increase in disease during pregnancy. 5 women had exacerbation of articular symptoms, including 2 patients diagnosed with systemic lupus erythematosus, with 1 patient with rheumatoid arthritis, 1 patient with mixed connective tissue disease, and 1 patient with overlapping syndrome of rheumatoid arthritis and systemic lupus erythematosus. Patients suffering from rheumatoid arthritis require intra-articular corticosteroid injection. Patients with systemic lupus erythematosus who did not decide to undergo the recommended mitral valve surgery before pregnancy developed respiration insufficiency with pulmonary edema due to exacerbation of mitral regurgitation in the mitral valve complex defect, whereas pregnancies in the case of patients with mixed connective tissue disease, the pregnancies ended in stillbirth. Conclusion. And lastly, all patients diagnosed with systemic connective tissue disease should receive multidisciplinary care prior to conception, during pregnancies, in the postpartum period. Furthermore, they should be monitored by a team of specialists due to the risk of disease exacerbation and high rates of maternal and fetal complications resulting from the underlying condition. Thank you for all of your attention. Sorry if I made a mistake. Goodbye.